Hi, my name is Robert McCarran. I'm a professor of psychiatry, associate dean for medical education, and director of education for the Susan Samuel Integrative Health Institute at the University of California, Irvine School of Medicine. Thanks for your interest in our medical education programs. Over the next few minutes, in addition to describing our flagship program, the UCI School of Medicine's Train New Trainers Primary Care Psychiatry Fellowship, or TNT PCP Fellowship, we'd like to tell you what drove the TNT faculty to start these innovative and clinically practical educational programs. Our TNT faculty are mission-driven to significantly expand and optimize the collective psychiatric workforce nationwide and beyond. We want to make the practice of primary care psychiatry easier for medical providers, with the end result being better care for patients struggling with depression, anxiety, substance use disorders, chronic pain, and other conditions. Up to 65% of all mental health care delivery in the United States is delivered in the primary care setting, not by psychologists, social workers, or even psychiatrists. Many patients in need of behavioral health care for conditions like depression, anxiety, substance use, and sleep disorders are unable to access care by a mental health provider. Primary care providers, internists, family medicine physicians, pediatricians, nurse practitioners, physician assistants, women health specialists, and emergency room doctors serve as the de facto mental health care providers in this country. Unfortunately, many have not received sufficient training in behavioral health and often experience the pressures of seeing a large number of patients in a short period of time. TNT Fellowships provide training in primary care-based psychiatry and help PCPs diagnose and treat the most common psychiatric disorders in the primary care setting. Put another way, TNT primary care graduates feel more comfortable and experienced while providing primary care-based psychiatric care to patients with common psychiatric conditions. It is also important to emphasize that our faculty teaches TNT fellows how to train other providers in their clinic and region. Ultimately, with our unique training program, we squarely address a growing mental health workforce shortage by educating those who deliver this care the most, primary care clinicians. TNT Primary Care Fellowships include 3 separate tracks. First, primary care psychiatry. Second, primary care-based child and adolescent psychiatry. And third, addiction medicine. Our year-long TNT fellowships are designed for health professionals working in a busy primary care or other healthcare settings. The curriculum has been developed and uniquely taught mainly by multi-trained physicians in family medicine, pediatrics, addiction medicine or internal medicine, and psychiatry. Most of our faculty are PCPs and psychiatrists. Our TNT PC fellowship faculty understands the demands of working in busy healthcare settings with often limited resources. TNT primary care fellows can work full-time and participate in the fellowship, mainly during non-clinic hours. The TNT primary care fellowship is designed to minimize interruptions or disruptions to patient care. Our trainees can keep their jobs while learning with us. Upon completing the program requirements, graduates will receive a certificate of fellowship completion from the University of California, Irvine School of Medicine. 4 core curricular components exist during the 1-year training in all of our primary care fellowships. First, each fellow will attend 2 intensive weekend learning sessions. Fellows learn core topics such as motivational interviewing, how to do a psychiatric interview, and effective screening and treatment of mood, anxiety, pain, and substance use disorders. There is an emphasis on addressing chronic pain in the context of psychiatric illness. The second core curricular component includes 2 interactive, web-based learning sessions with our TNT Fellowship faculty each month at noon or in the evening Pacific time. Fellows receive over 50 continuing medical education units and may also qualify for maintenance of certification units. Each fellow is also paired with a small group faculty mentor with whom they have monthly web-based meetings to discuss individualized and small group learning plans. Lastly, our TNT alumni are encouraged to participate in monthly small group mentorship sessions and other learning opportunities during the course of their career, all at no additional cost. After several years of training over 1,200 fellows, we are proud to offer a proven, evidence-informed learning model to provide clinically practical information in primary care psychiatry, addiction medicine, chronic pain management, and pediatric primary care psychiatry. Our TNT team is committed to a much-needed, meaningful, and sustainable expansion of the psychiatric workforce. Here are just a few of the outcomes among and about our TNT alumni. Our data demonstrates significant improvement in fellows' overall psychiatric clinical knowledge. TNT learners exhibit decreased provider stigma towards those who have mental illness. TNT alumni are better able to recognize and treat depression. They're more likely to prescribe antidepressants when compared to non-TNT providers. Our TNT graduates prescribe less opioids and employ more effective treatment modalities for the management of chronic pain when compared to those who did not enroll in our TNT program. Upon completion of training, TNT fellows are much more comfortable effectively treating common conditions such as depression, anxiety, and somatic symptom disorders. Over 85% of our graduated fellows treat patients in underserved geographical areas where access to specialty behavioral health care is limited. Our curriculum is published in a textbook, ebook, and handbook format for further study. Our fellowship faculty, most with multidimensional training in psychiatry, are national leaders in education, research, healthcare policy, and healthcare delivery. Our programs have a strong emphasis on the promotion of wellness and the prevention and early detection of conditions, particularly in the child and adolescent population. Our TNT team want to make medicine care easier for you and your patients. Please scan the attached QR code or visit the TNT Primary Care Fellowships website to find potential scholarships and funding opportunities which support this crucial clinical training. On behalf of the TNT Fellowships, directors, faculty, staff, and valuable community partners, thank you so much for listening. Please let us know if you have any questions or are interested in joining our TNT Primary Care Fellowships. Thank you.